Hello, Jessi. My name is Taylor.
My name is Avani.
And I'm Valerie.
Okay, so we are part of HOSA, like a student health organization, and we decided to do a competition that starts later in February, but we chose the competition Community Awareness, and our topic is back pain and like back health, specifically for teens and adolescents.
Yep, so can we just start by getting your name and occupation?
So my name is Jessi Heinsohn. I am a doctor of physical therapy.
Okay, so what are some of the most frequent causes of back pain that you see in your patients?
Well, it definitely depends on the age group that I'm seeing. Typically speaking, if I'm seeing someone younger, it's more often than not either like an acute injury or it can be more of a chronic condition. Most often for younger individuals, it's going to be more like instability related. So lack of motor control, lack of strength, and then potentially some like hypermobility disorder as well. If I'm seeing someone a little bit older, oftentimes it's more like arthritic in nature. It could be some disc degeneration, or it could even be some amount of like a nerve issue as well. I've also seen some fractures.
Okay.
For teens, like when you say instability, is that usually like, what is that usually caused by?
Oftentimes it's more just lack of strength, but there's also a component of, there are a lot of individuals that are hypermobile, so super flexible people. So I often think of like gymnasts or cheerleaders, dancers. Typically people along that line, they are very, very flexible, and oftentimes it does translate over into the joints as well. So they're getting past the standard like muscle length where they do more of a ligament or joint hang, which does cause additional stress on the joint as well.
How important would you say like posture is, like especially like for our like generation? Like a lot of people, they don't pay attention to that because we're always like busy working this, whatnot.
I think it's going to continue to become a more critical issue, as often times even in high school at this point, you guys are using computers even more so than like getting up and going and to the board and things of that. So it's critical. I see 20-year-olds coming in already with like chronic postural conditions that I don't even normally see. I don't see until like 50s and 60s, and I'm already seeing it now. So it is definitely something very important that if people aren't working on it when they're younger now, especially with being more tech related, more like laptop usage, it's very convenient, but you're going to have a lot of postural compensations with different types of like technological advances.
Oh, so you're already like seeing?
Oh yeah, no, I see like 22-year-olds coming in, and I'm like, you're already sitting hunched like this, and you look like you're 50 years old from the postural standpoint. Like it's very apparent.
Oh wow. Okay.
Who would you say is at high risk for back pain and injuries?
Typically, I would say individuals with like lower muscle mass are going to be at more risk, just because they're going to be more likely to have less motor control. So they're going to be more frequently using those passive structures for stability. So rather than using their abdominals and their paraspinals, they're going to be just kind of stacking everything on top of one another and just jamming down on the joints.
So what would you say is your approach on diagnosing or treating back pain within patients?
So whenever someone comes in with back pain, if they come in and they have seen a physician, that can, if they've done some imaging, that definitely will give them some more information. But if they haven't done any imaging and, they just kind of went in and were like, oh, just standard back pain, I normally do a pretty expansive subjective interview. I'm asking a lot of questions about symptoms, when they started, things that make it better, worse, and then also kind of their day-to-day activities, so work ergonomics, what their normal routines are, and then after that I do more of an objective assessment where we're going to look at posture, for example, is the first thing I kind of look at, which I don't really tell them I'm looking at it. I'm looking more when I'm interviewing, and then I'll do range of motion, strength. I do some special testing as well, which ultimately is just various tests for different types of diagnoses, so it kind of just clues in what we're most likely looking at, and go from there.
That's really cool. What do you normally like more talking about you, like what does your day-to-day life look like as a PT?
So it kind of depends on the day. So I am also a clinic director, so I do have some amount of administrative tasks, but for a PT specifically, I normally see 1 to 3 evaluations a day where I'm seeing a new patient, and then I do have follow-up treatments for all of my patients. It does require documentation. It is a medical appointment, so the evaluations are a lot more expansive on the documentation requirements, just because you have all the testing and all of the diagnoses codes and treatment codes and palpation and joint mobility that you're looking at. But on the treatment sessions, I'm still writing a full note of what they're presenting with from a subjective standpoint, so how they're feeling, what went right, what went wrong last session or during the week, how they respond to treatment, what my plan is for the next appointment, any objective measures I take. So if they're like, oh, well, let's look at range of motion, I'll write what the range of motion looked like during that assessment, and then I'll also fill out the flow sheet for all of the exercises or interventions that we did that day. So it depends.
Yeah.
What is the most challenging and rewarding aspect of your job?
I think the most challenging thing is the education aspect. A lot of things about PT are, I can give everybody the right tools to get us to the point where, but then you have to have the patient do the work. Which I think that is just a very challenging thing in general, as a lot of us like the passive care. We love massages, we love going and just having someone else fix the problem for us. But I mean, just like with going to the gym, PT is not a magic pill. You do have to put in the work. And so that's a very frank conversation that you have to have with patients at the beginning. We're like, hey, more than happy to help you. Here's what we have. Here's what I'm going to do for you. But also, this is what you have to do for me and for yourself. And so it's very much, you have to kind of set the standard, and it's not just a one-time conversation. There's been times where I'm like, hey, well, you're not getting better because you're not doing what we talked about you need to do. And so it can be uncomfortable, but normally people respond pretty well with it, and we just have to have that compliance. So that would be the most challenging thing, but most rewarding is just people getting back to their normal day-to-day activities. One of my favorite cases this year, I think her 70th birthday is next year, and she told me, she's like, I've never been in better shape than I am now than I was 20 years ago. So I'm like, that's pretty impactful. You have the ability to really teach people how to use their body and how to use it well and how to be excited to use your body. I think because we are so used to just doing a lot of technology, we kind of forget that being able to move your body is an incredible thing until you all of a sudden can't.
Yeah. When you mentioned that woman, the 70-year-old woman, 70th birthday, how did you, what was her problem when she came in, and how did you fix them?
So this person had a fracture in the ankle, and then ultimately, once that had resolved and we had worked through PT, we did some prep for a total knee replacement, and then I saw her again after a knee replacement, and then we worked back to not only just regaining all the range of motion that's required after a knee replacement, but also just return to gym activities. So going back to the gym, she was wanting to take some dance classes and stuff like that. And also, this patient was a very lively person in general. I'm not saying she's the standard, but that stuff does happen, and it's really pretty cool when it does.
So you just encouraged her a lot to move more and be more active.
And part of it is coming in here, it should be hard. When you're in a lot of pain, I'm not pushing to a point that a patient can't handle, but most of the time my patients are leaving here, and at the end, towards the end of their care, I'm if they're not sweating or they don't feel it's almost like a gym workout. If they don't feel like they put in a lot of effort here, I'm well, then we wasted our time for the past hour.
So would you say there's any big changes that you've seen in physical therapy recently, such as new technology or different types of stretches or anything like that?
As far as for technology, there's new treatments that come out all the time or that are being developed. I would say that it's not we don't see a lot of quick changes in PT mostly, or in just medicine in general, just because we are kind of beholden to what insurance reimbursements will allow. So some treatments will be covered. It's with with insurance, we always just have to kind of be aware of that. If something's not covered, well, then we can't really provide it. So that makes a difference. But dry needling has been really impactful.
What's dry needling?
So dry needling is essentially, they're acupuncture needles, but you're using those needles to target certain musculoskeletal structures. So I will work on a patient with dry needling if I feel like they need an acute inflammatory response of a specific muscle. Oftentimes I'll use it on like a muscle that I can't really get to with my hand, so I'll dry needle like in the jaw, stuff like that.
Is there, like, would you say that there are any treatments that are like non-invasive to the body that's like pretty effective?
Yeah, so I do a lot of like myofascial release. I also do like scraping, where I'm using a scraping tool to help increase circulation to the area, but also breaking up any fascial adhesions.
Okay.
So I use that often in the back. I also have been using a lot of like KT tape lately, because that does help with blood flow circulation, and it does also help with like bruising and as well. Like I had one individual that came in with their foot was like double the size it should have been. I put tape on it and it was super bruised, and the next time it came in there was no bruising whatsoever.
Does the tape have like medicine in it, or is it just...
No, it just you're adding a little bit of tension on it, so it helps lift the skin a little bit. So essentially it just gives the fluid a little bit more room to flush out. There is some amount of research on it, but it's not super expansive. But clinically, it is very apparent when you see someone one day and 2 days later there's no bruise. That's, you know, that the tape did something.
That's pretty cool.
Yeah, and and these people, they've had the bruise for like months, and they come in and you do it, and you're like, okay, well the one thing we did different was tape. Like obviously that's what did it.
Yeah.
So our group Backs on Track is geared more towards the teens and adolescent side. So what would your advice be for them to take care of their posture, especially when they have to wear backpacks all the time during the school year?
Yeah, so keeping the backpacks in a good, like a more optimal position is definitely ideal. Double shoulder, but also not having them too low or too high. I also really like the backpacks that are not super heavy either. You're already packing them with so much stuff. Like I like the lighter. I think the hiking backpacks are typically my go-to. I also like the backpacks that have like the chest strap if you want to use it, because then you can kind of change the position of the backpack whenever you need a break. As far as for other things, I would say it's probably more the sitting than carrying the backpack that I would say is the issue. It's just you guys are sitting in class all the time. So the main thing is, being able to get up and move around, but also whenever you are sitting, try not to sit like super hunched over all the time. Not to say that you can't hunch over, but just being aware of what your body's doing all the time. Because if you're doing it for 8 hours straight, that's going to make a difference.
When you're like, for example, like studying or like doing homework, like how often should you get up to like move around?
I'd probably say every like 30 minutes.
Oh wow.
I mean, that's why I really like stand-up desks, honestly. If you can just even change your workstation a little bit by just going from sitting to standing every 30, 40 minutes, it's going to make a big difference.
Oh, wow.
Other option too is if you're sitting for prolonged periods of time. I do have some of my patients where they're like, I don't have the option to stand. They will sit on like an exercise ball, because there's an amount of like postural control that you have to have. Versus if you're sitting on a backed chair, you can kind of lean back and turn everything off and just use the chair to support you, which isn't bad, but when you're doing that all day, that's going to be adding a lot of pressure through the more passive structures.
This is similar to the last question, but are there any other healthy habits that you would recommend to people to have when it comes to their posture or movement?
I mean, I would just say some amount of exercise every day. It doesn't necessarily have to be like going to the gym and doing like heavy lifting, but I mean just general get movement, because when you're sitting for 8 hours, you're not moving around that much. So even if you're just going for a walk like for 30 minutes every day, I'm like, that would be helpful, just because you are going to be activating those muscles, you're going to be getting increased blood flow to the area. So if you do have any potential issues there, like the blood flow and muscle activation can help flush it out before it becomes a problem.
So I mentioned earlier like the studying thing, like if we're sitting all day for like 8 hours, is it beneficial to like just stretch for like 10 minutes a day? Is that impacting you at all? Is that not
Yeah, I mean definitely getting some amount of mobility, assuming that you're not one of those individuals that's just super hypermobile. Getting some additional like stretch in all of the structures that are tight after you've been in a seated position for a long period of time would definitely be helpful.
So why do you think back pain is often overlooked as a serious medical condition or issue?
Because everyone has it. Most people have super weak core muscles and poor posture. Everyone just thinks, oh well, once you're 20, your body starts falling apart. I'm like, well, I mean, yes, it does start gradually declining, like you're not, but you can maintain it. And I think oftentimes, the back thing is just, well, it's unsupported because it's just this one column and there's no other joints around it to support it. I'm like, well, that's what our muscles are for. I think that there's just been this long-standing culture of, oh, well, once you have back pain, it's just over from there and you just have to manage it however you can, whether it's injections, but just going to the chiropractor every week for the rest of your life. I'm like, well, that's seems very unsustainable. I've had some people where they've come in and they no longer have back pain anymore just because they figured out what they're doing that's causing it, and then we're making adjustments from there. A lot of it is we're our own worst enemies, and we're like, well, it hurts when I sit, but I have to sit for my job, so I guess this is it now. I'm going to have it forever. I'm like, or we can make some adjustments and we can go from there.
Yeah, I mean, like, even me, like, I didn't pay too much attention to, like, posture and stuff. I always thought it was just like, I mean, everyone has it. And I do remember when I was a freshman, I was taking choir, and we were required to stand to sing, and the director would always call us out, like, keep your posture straight, and he would even show us a picture of, like, the buffalo hump, and so, like, this is gonna happen to you if you don't keep up your posture. And then at that moment, like, every single day after that in class, so it's just,
that is correct. Again, I've seen some 20-year-olds already come in and they already look like that. You're like, okay, well, you've only been in your industry for like 5 years. What are you gonna do? What are you gonna look like in 20 years?
Yeah, that's that's the main like nuanced thing about our project, is that it's such a common issue that people might be like, oh, what's the big deal, right? Because some other projects are doing like strokes or cancer, but the thing is, it's so common that it's so overlooked, and it's an issue that will impact you in the future as well.
Absolutely. And in addition, just because a lot of people do have back pain, I agree, they are kind of like, like whatever. A lot of people tend to start having other issues pop up, right? Because if you have postural deficits, I'm like, okay, well, if you're hunched over, I'm like, well, now you can't reach all the way up over your head because your muscles just can't go any further past that. So then you're going to start seeing a lot of other things pop up. You're going to see a lot of neck pain because I'm like, well, if you're hunched over, then you're going to start doing this. People start getting migraines. From head, like from their neck position.
Oh wow.
And it can be some nerve irritation. It can be tension headaches from like muscles are triggering those headaches. It also can be cervicogenic, meaning the joints in the neck being in a certain position can be triggering those headaches. So you can get a lot of other issues that happen after low back pain, and it's not necessarily the low back pain that's causing it, but it's the cause of the low back pain being poor posture, poor muscle control. All of those can cause those other issues.